Hello, my YouTube family. This is Dr. Lee, so I'm back again with another one of my videos. And today we will be doing the skills for Credentia, which talks about providing catheter care for a female. This is skill number 18 in the book, providing catheter care for a female. This skill is done on a mannequin. So I'm going to talk about what supplies I'll be using. I'll be using 2 bath towels, 2 washcloths, a pair of gloves, a bath blanket, my bath basin, and soap. Okay, and with that, I'm gonna go ahead on and get started with the skill. I'm gonna step out, knock on the door, and come in, and we'll start the skill. Good morning, Miss Mary. This is Dr. Lee. How are you doing? I'm your CNA for today, and I'm here to do catheter care on you. Is that okay? Great. I'm going to go ahead on and pull the curtain to provide for privacy. I'll wash my hands. Now that my hands are clean, I'll gather my clean supplies, and I'll be right back, and we can get started. With my bath basin, I'm going to get at least about 1/4 of a basin full of water. For the skills with Credentia, there'll be a table or a shelf or something that will have all the different supplies on it, and you just go to wherever it is in that room and get your supplies that you need. So I got 2 bath towels, 2 washcloths, bath basin, gloves, soap, and a bath blanket. Okay, so now I'm ready to put water into the basin. Since my hands are clean, I don't want to turn the water on with my clean hands touching the water faucet. So I'm going to turn the water faucet handle on. Turn that so you can see the water running. Now I'm going to test the water to make sure that the water is comfortable. Water feels comfortable, so I'm going to dry my hands. Now I'll put water in the bath basin, and I normally use about 1/4 of a basin full of water. Okay, once I have 1/4 of a basin full of water, I'm going to go ahead on and turn the water off. Again, using a paper towel. Have the water off. I like to get an extra paper towel so that the patient can dry her hands with. This is not a requirement getting this extra paper towel. So I'm going to go put it on my bedside table and turn the camera so that you can see what I'm going to be doing with the patient. So Miss Mary, I'm back. I want to have you test the water, if that's okay with you. So we can make sure it's at the right temperature. So I'm going to bring the basin by the bed, put the patient hand into the water. Is that okay, Miss Mary? Great. Let's go ahead on and dry your hand. All right, you can put it under the cover if you like. I like to put my gloves on at this point, but the instructions from the state is that you put the gloves on before you start washing. So putting them on now meets that criteria before I start washing. So I'll just put the gloves on now. I'm going to get my 2 washcloths, and I'm just going to put it in my basin of water so that they can be getting wet. Miss Mary, I'm going to take 1 bath blanket and put it across the top of you to keep you covered on top, and we'll take your top sheet and bring it down to your knees. Okay? go ahead and bring your gown up to your pelvic area. All right. I'm going to get one of the bath towels that I brought. I'm going to put it under your hip area so that we can make sure we keep your fitted sheet dry. So if you can raise your hips up, great, good job. I want to make sure I have both buttocks under, on top of the linen protector. My other towel would be to dry with. So my supplies, I had 2 bath towels, 2 washcloths, a pair of gloves, my bath blanket, basin, and soap, okay, for catheter care. So now I'm going to take my first towel, wring the water out, put soap on my towel, okay, and I'm going to massage it in. And I'm going to hold the catheter at the meatus, which is in between the labias. There's an opening where the catheter goes into the body, and I want to hold the catheter at that point. So I want to get between the labias and hold this catheter. I'm pinching the catheter off, and I'm going to wipe away from the body. If I go down to the end of the catheter, that's about 3 or 4 inches. So now that I've used this, it cannot go into the water. Now I need to rinse the catheter. So I'm going to get my second washcloth, wring out the excess water, because I don't want to be dripping water on the patient. So this is just rinse, no soap on it. I'm going to follow the same procedure. I have it pinched right at the meatus. Right where my fingers are, I'm going to wipe out on the catheter. Okay? This does not go in the water. So now I have washed the catheter, rinsed the catheter. What's left for me to do? To dry the catheter. So I have my dry towel here. Anytime I am manipulating that catheter, I better have it held secure right at the meatus. So I'm going to hold here, and I'm going to pat dry all the way down. Okay, if I go down to the tip of the catheter, that's approximately 3 to 4 inches. So I have done wash, rinse, and dried the catheter. So I provided catheter care. I'm going to have the patient raise up. Miss Mary, if you can raise up, let me remove this towel from up under you. This is the towel that I had put down so that the patient would not get their bed wet. Put the gown down. And now I'm going to cover the patient up and take the bath blanket. Okay. All of this will go into the linen hamper that will be in the room. I'm going to bring this over to the side. My soap, I'm going to put in the designated dirty supply area. My towels, bath base, I'm going to put in the hamper. My wet towels, I'm going to put in the hamper. Okay. Now I'm going to empty, rinse, and dry the basin. So I'm going to dump the water out, empty. My hands are dirty, so I can turn the water on. I want to rinse the basin out. And I want to pour the rinse water down the sink. And now I want to dry the basin. Make sure you dry inside and out. And somewhere in the room, there will be a pink sign that says designated dirty supply area. You want to put this basin and the soap in the designated supply area, wherever that is. Now that I've put everything up, I can take my gloves off, wash my hands. So with my clean hands, I'm going to go back to the patient give the patient a call light, and start ending my skill. So Miss Mary, here's your call light. You can push the red button if you need to get a hold of me. All right, I'm going to open your curtain. I wash my hands, and then I would look at the evaluator and say, I'm through with my skill. Okay, so let's talk about it as we normally do. Lost my page. Okay, on skill number 18, provides catheter care for a female. So number 1, we explain what it is that we're going to be doing. So knock on the door, come in, introduce yourself, and tell the patient what you're doing. Number 2, privacy. I pull the curtain. Number 3, before washing, before you put that water on the patient, I need to check the water and have the client check the water for comfort. Both things have to happen with number 3. Number 4, I put on my gloves before I started washing the client, okay? Number 5, I put a towel for my linen protector underneath the buttocks area before washing. So I have a lot of before washings, okay? Number 6, I expose the area surrounding the catheter, and they got a little parenthesis there. They say only expose client between the hip and the knee. So I brought the blanket to the hip area and I took the sheet down to the knee. So the only thing that was open was between the hip and the knee. That's very important for all of these perineal type skills, okay? Number 7, apply soap to a wet washcloth. You cannot put the soap in the water because you have to rinse, and you need clear water to rinse. So I'm going to wring out one of my washcloths, wring it out so you don't have water dripping, and then put soap on that wet washcloth to start my washing. Now number 8 and 9 is in bold, and anytime I have something bolded, it means that I must do it or I will flunk the skill. There's no ifs and buts about it. You must do number 8 and 9 in order to pass this skill. So number 8, while holding the catheter at the meatus without tugging, without pulling, clean at least 4 inches of the catheter from the meatus, moving in only one direction away from the meatus. So I'm going to hold with this pencil. If this is the catheter inside the person, I wash away from the patient, away from the patient. And also when I rinse, which is number 9, I hold the catheter at the meatus. Where's the meatus? The opening where the urine comes out. So between the labias, I'm going to hold that catheter using a clean washcloth. So let's talk about that. That means the washcloth that I used that had soap on it, I can't use it again. I have to get another washcloth because I brought 2. Now I'm going to get a clean washcloth to rinse with. Okay, this is my second washcloth, and I'm going to rinse at least 4 inches. Again, wherever I held it at, I'm going to wipe away from the patient on that catheter. All right. Number 10, hold the catheter at the meatus without tugging when you dry at least 4 inches. So what am I going to do with that catheter? Hold at the meatus, wash, put the towel down. Get a new second towel, rinse, put the towel down. And then I'm going to dry, and I'm going to pat dry. When I say pat dry, pat, 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 pat. Don't rub it. Pat, 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 pat dry. Okay, and this is what they want us to do. Now, when you are drying, the state don't care. You can use a towel or a washcloth. So you can use the big towel or you can use a washcloth to dry with. Okay. Number 11, empty, rinse, and dry the basin. Number 12, place the basin in the designated dirty supply area. I showed you where that was here at our school. Excuse me. And I would put the basin there. Number 13, dispose of used linen into the dirty linen hamper, soil linen hamper. Number 14, avoid contact between candidates' clothing and used linen. 15, remove your gloves, wash your hands, and make sure the patient have the signal device. So this is providing catheter care for a female. If you have any questions whatsoever about performing this skill, please leave me, you can write your questions in the comments below. And don't forget to subscribe, hit the like button if you like this. It just helps the video to show up on YouTube, and also keeps me on YouTube. Okay, so if you found it helpful, please subscribe to the channel and hit the like button. All right, so that's it with skill number 18, providing catheter care. I hope it was very helpful. I wish you all the best luck with your skill. All right. So with that, I will see you in the next video. Take care. Bye.